Hello, my name is Sudy, and my case study is on a heterotopic pregnancy. So a little bit of what we need to know about our patient is they're presenting to the ER with abdominal pain and vaginal bleeding. So our patient is of childbearing age, a 26-year-old female. She does have history of infertility, so she has undergone IVF treatment, and she does have a previous ectopic pregnancy, which is important to note because most women that have had a previous ectopic pregnancy are more likely to have another ectopic, or in this case, a heterotopic. So she does also have use of history of the IUD use, and then a family history of twins. So some relevant lab values we need to know about our patient is the elevated HCG. So the patient also did have a positive pregnancy test, so that would explain the elevated HCG. And then the patient does have elevated white blood count. So whenever there is an ectopic or a heterotopic pregnancy, there can be like inflammation or irritation either in the peritoneum or somewhere else, so that can cause leukocytosis, which is that elevated white blood count. So that would explain that. And then she does have normal progesterone. So we know our patient is pregnant because she has, or we suspect she's pregnant because she has a positive pregnancy test, elevated HCG, and vaginal bleeding. So we're going to go for the OB first protocol. So most cases, OB first, you do a abdominal and then a transvaginal. So a transvaginal is usually optional, but since our patient has that positive pregnancy test and it's kind of like a dating ultrasound, we want to look inside the cavity just in case we can't see on top and just to get a better look of what the problem may be. So we're going to evaluate the uterus in both the sagittal and transverse plane. We're going to look at her cervix to make sure there's no dilation, funneling, anything like that. We're going to look to see where the pregnancy has implanted, whether that's intrauterine, extrauterine. So in this case, it's both. Identify the yolk sac if we see it, and the gestational sac, make sure we measure the placenta if we can see the placenta, depending how far along she is, and then to check for any fetal heart tones. And we would take a look in both the nexus as well. So this is our ultrasound images. So we can see that there is an intrauterine pregnancy because this is baby right here, and baby's measuring 11 weeks and 6 days. Baby does have fetal heart tones, and we can see the gestational sac. And then in this next image here, we see another baby. However, we're looking in that right nexus. So we know we have an intrauterine pregnancy and then an extrauterine pregnancy. And this baby also does have fetal heart tones, and we measured the CRL. This is very rare, but both of these babies do have fetal heart tones and are both alive. So my impression of this is that we do have an intrauterine and extrauterine pregnancy, 11 weeks, 6 days. One is seen in the uterus and one is seen in the righted nexa. And they both have fetal heart tones. And then in our ultrasound images, we know that there is some free fluid in that pelvic cavity. A differential diagnosis would be that this is an ectopic pregnancy. However, since there's two, one intrauterine and one outside, this is heterotopic. And it's not your normal case of twins, because twins would be like both inside of the uterine cavity, but one is in and one is out. One is an ectopic. So what is a heterotopic pregnancy? A heterotopic pregnancy is when there's two pregnancies seen, like we said, one inside of the uterus and one outside. And in most cases, it'll be in the fallopian tube, but it could be anywhere like the abdomen, the ovaries, and the liver sometimes, which is really rare, but possible. So what we need to know about heterotopic pregnancies, so like I said, our patient presented with abdominal pain and vaginal bleeding, so those are common symptoms, and then you can also experience dizziness and nausea. Some of the risk factors for heterotopic pregnancy is PID, pelvic inflammatory disease, IVF, endometriosis, if they've had previous tubal surgery or smoking. Some educational information about heterotopic pregnancy. So like I said, these are extremely rare. It only happens in about 1 to every 30,000 pregnancies, and it can be life-threatening because you have that ectopic pregnancy where it's not supposed to be and it's not supposed to grow. So it's most often in the fallopian tube, but like I said, it could also be anywhere in the abdomen. It could be in the nexa, the ovary, anywhere like that. And it is possible for both pregnancies to have fetal heart tones. We can diagnose and detect these heterotopic pregnancies with ultrasound, so transabdominal and transvaginal. So treatment and prognosis. So one of the most common questions is, can both babies survive? Unfortunately not. The one that's outside of the uterus is not viable, and it can be life-threatening to the mother, so they would have to surgically remove it if it hasn't already ruptured. But the prognosis is usually well for the baby that's inside of the uterine cavity where it's supposed to be. So there's a couple different treatment options depending on the different cases. So like I said, it could be surgically removed if there's like an emergency, or they could do an ultrasound-guided local injection, and that could be used to also terminate the ectopic. So this is part of the case study. These are post-treatment images after they have removed the ectopic pregnancy, and this is 2 days post-salpingectomy. So this baby, the ectopic was in the fallopian tube because salpingectomy. And so now they're just evaluating the baby that's inside the uterus, and baby was doing fine. CRL is still measuring up to date, and the baby has fetal heart tones. And that is all. Thank you.